Hello, everybody, and welcome to our special Google Hangout on Air. I'm Sunny Galt with the New Mommy Media Network. We produce audio podcasts for new and expecting parents, but we also do these amazing hangouts on really important topics that you have told us you want to know more about. And this hangout is a partnership that we have with the Parent Connection and Scripps Health. And today we're talking about midwifery. But before we get into midwifery and what is a midwife and educate you all about the process of bringing on a midwife onto your healthcare team, we want to check in with Pam Nagata. She's with the Parent Connection. And if you don't know about the Parent Connection, we talk about it quite a bit on these hangouts, but it's a great resource for parents in the San Diego area. And Pam, why don't you tell us a little bit more about the Parent Connection and how parents can get involved?
Great. Thank you, Sunny. Well, since 1980, the Parent Connection has been involved in the community, assisting families linking together within each area that you live in through neighborhood play groups. We have educational classes. We have special events like we're doing a magical Wonderland magical tea party this weekend. We have the family swap meet. And today we have a special guest, and we're so excited about it because of Scripps Health. We have Scripps Clinic, who has 24-hour midwives at Scripps Memorial Hospital in La Jolla. And also at Scripps Hospital in Encinitas, they have midwives available there too. So we're so excited to have them and to learn more about what midwives can do.
All right, and we're going to meet our expert in just a second. I'm going to give you guys a couple minutes just to get situated over there. Keep in mind, if you guys are watching this Hangout live and you have questions as we're going along, if you're on the episode page for this Hangout, you can go to newmommymedia.com/live for that link, and you can actually post questions, and I'll be monitoring it. So if you do have questions for our expert or for myself, we can certainly get those answered as we go along. All right, so our expert today is Jasmine Ortega, and she's a certified nurse midwife. So hi, Jasmine. Welcome to our Hangout. Why don't you tell us a little bit about yourself and your experience?
Hi, Sunny, and hi, everyone. I'm Jasmine, and I've been a practicing nurse midwife for 14 years. And the last 3.5 years ago, I've been on staff here at Scripps Memorial in La Jolla. I am a mom of three, busy mom of three, and I just love being a nurse midwife. So it's great to be here. Thank you for having us.
Absolutely. So I have to ask, how old are your kids? You said you had 3 kids. What are their ages?
So I have an 11-year-old, an almost 10-year-old, and a 6-year-old.
Okay.
So pretty busy.
Yeah, I was going to say, and they're probably out doing a bunch of activities and stuff. They're at that age, right, where they're going out doing all that kind of stuff.
They are, and they were all birthed with midwives. So it's just kind of like a thing for my family and having kids, is just being with the midwives.
All right, so let's dive into this a little bit and educate our audience about what a midwife is. So basic question, what is a midwife?
Well, certified nurse midwives are licensed advanced practice nurses, and our job is to provide healthcare for women across their lifespan, and specifically for women in the childbearing years. So that includes well women gynecological care, prenatal or pregnancy care, labor and delivery care, and postpartum, which is right after you give birth. So it encompasses all those things. Philosophy-wise, I feel that is such that we support women through their pregnancy. We support them pregnancy as a normal process, and that includes not just pregnancy, and a normal process of pregnancy, labor, and the newborn postpartum period. Our approach is that we introduce medical interventions only if indicated and necessary.
Okay, so if someone is interested in having a midwife as part of their team, let's kind of break down the difference between a midwife and an OBGYN. What are some of the differences between the two?
Okay, well, I can tell you the similarities first. Let's start out with that. With standardized evidence-based care, both midwives and nurse midwives and OBGYN physicians can care for women throughout their pregnancy, labor, birth, and postpartum period. What makes the difference lies in our scope of practice. As nurse midwives, our focus is on normal, healthy, uncomplicated pregnancies, and we assist women through their normal, uncomplicated vaginal deliveries. There are some nurse midwives, however, that are specially trained to assist our physician OBGYN partners for routine routine cesarean sections as well. And doulas, on the other hand, provide non-medical support to a woman and her family during her labor. A doula provides emotional and physical comforts during that process, but they are non-medical providers.
I remember, I have 4 kids now, but I remember with my very first baby, I was actually assigned a midwife, and I was really surprised by that. I didn't know much about midwifery and the different, types of care, and I had a lot of questions about that. So, when it comes to having a midwife versus an OB, is there any time where you would be assigned both, or is it usually just one or another, assuming it isn't a complicated or at-risk pregnancy?
That's a really good question. That really depends on the clinic and hospital setup. At Scripps Memorial in La Jolla, patients are seen by their OBGYN physician of choice in the clinic and are followed by his or her, sometimes their physician assistant or nurse practitioner. At our hospital, nurse midwives provide the inpatient care, so within the hospital setting, but they have a choice. Patients always have a choice between a nurse midwife or an OBGYN physician. Okay. And I think you had mentioned when will care be transferred, or is there a need?
Yeah.
Is that?
Yeah, that's a follow-up question.
Yeah. So a patient's care would be transferred if her medical condition becomes high risk or complicated, or baby requires assistance from a vacuum or forceps, or requires a cesarean section. That's when the care would be transferred over to the physician.
Can the midwife actually deliver the baby, or during the labor and delivery process, or is that something that an OB would have to assist with?
For an uncomplicated labor and delivery, a midwife can attend the birth, definitely, and supervise that.
Okay. Does that mean they're actually catching the baby, or, bringing the baby out, or is it okay? Okay.
Yes.
All right. And then in those cases, is there an OB on call just in case something happens and the situation becomes more involved than what they originally intended or thought was going to happen?
Yes, there's always a physician in-house at our hospital and can be accessed there in minutes if complications should arise. But they're always in contact with us. We work collaboratively, so we're working together, and they're aware of things that are happening. As far as labor and delivery is concerned, they're aware of the patients that are there. We're constantly updating on what we have going on, and we really work well together, supporting each other.
What about vaginal births after cesarean, also known as VBACs? That is a pretty popular thing I know here in the Southern California area. A lot of moms that previously had a C-section are going for vaginal births. Is that something that a midwife can assist with as well?
Yes, because we have physician coverage, or another way of calling it is backup within the hospital. Patients can safely have a trial of labor after C-sections and actually have a vaginal birth after a C-section with a nurse midwife.
Okay. And then let's talk a little bit about the training. What type of training is needed in order to become a midwife?
Our training involves the weaving of 2 disciplines, and that's nursing and midwifery. Certified nurse midwives start out with a 4-year nursing degree, and they continue on with a graduate master's degree, specializing midwifery. After our training, we also take a very rigorous exam to be certified nationally through the American Midwifery Board, American Certification Midwifery Board. And to maintain that certification, we actually have to continually get trained, receive training and education to just stay updated on women's healthcare.
How do women find a midwife in their area? Let's say they don't belong to the Scripps system. How would they find a midwife?
A great website is the American College of Nurse Midwife, and you can access them through midwife.org. That's a great website. And also just, finding out where through your insurance, where you can give birth, and finding out if midwives are there. That's like the best way to start. And then from there, they can refer you to clinics where you can get OB care and have a midwife there at your delivery.
So I have a personal question for you. Why did you decide to become a midwife? What was it about it that was appealing for you?
I was always into women's health care, right into nursing school. Maternal child health was like my favorite before I even had babies. And my first job out of nursing school was actually in a labor and delivery unit, and I loved it. And then I worked with a group of great midwives and who inspired me, and I ended up, getting into the field of midwifery, let's say like 5 or 6 years later after starting my nursing career, and knew that I just wanted to be there for women, giving them options, empowering them, and watching their transformation through the whole process of pregnancy, or even conceiving and pregnancy and delivery, and being there to catch that baby and get that first glimpse of that new mom, just changing. It's just something that I love and I'm very passionate about, that I'm lucky to do.
We'll include some of those links that you mentioned for additional information and how people can find a midwife in their area. We'll include those links on the episode page. So that way, if you guys are watching and you didn't catch all those links, just go to the episode page and we'll have it available for you. Well, Jasmine, those are the questions that I had. Is there anything else you'd like to add about the midwifery program or being a midwife that might help parents out there?
Well, know that what's great is that Scripps now has 24-hour coverage, and that's not something that's been available. Wasn't even available 5 years ago. So it's great that the community is interested in that. It's a great option if you have a healthy, uncomplicated pregnancy. The care you get will be great and individualized, and we can work with you through your pregnancy and birth. So yeah, thanks for having me.
Of course. It was great meeting you. And thanks for everyone for watching our Google Hangout today. Please check out the Parent Connection if you haven't already at sandiegoparent.com. And we also encourage you to check out New Mommy Media, where you can listen to all of our podcasts online. We also have app reviews and some other fun things over at newmommymedia.com. And if you like today's Hangout, just share it with another parent so we can help them out as well. Thanks so much.